Hi, welcome to the third episode of Tipsy Tooth Talk.
Or T cubed, because I can't say it.
I'm Dr. Bloom.
And I'm Dr. Bishop, and we're back to share with you a classic summer drink. So if you're from the South, you've probably had a mojito once or twice in your life, and so gonna share a little classic version of this recipe. It's heavy on mint, so if you like mint, this is your drink. All right.
So my mom just made one of these the other night.
Oh gosh,
it's her new fave.
Okay, so now I gotta live up to that. Awesome. Okay. All right, Carol, this is for you. All right, so I already have some mint in my glasses, and it takes about 10 to 12 leaves, and what you want to use is like a little muddler. A muddler makes a difference. I'm gonna shake this at you. So if you don't have a muddler, then you may want to get like a wooden spoon, but wood is the key. You don't want to use metal. You don't want to use plastic, because plastic can really kind of over muddle the mint leaves. You're really just trying to bruise them. You're not trying to crush them.
I didn't know that. What about the stone ones? Like I used
Like a stainless steel one or something?
no, like a stone. Like
Oh yes, stone.
You can do
wood.
a stone one?
Yes, because
Okay.
when I looked it up, because I googled that, it said like a mochajete. So if you
Yeah, that's what I used at my mom's house the other day.
Oh, well, there you go. So a mochajete would work as well. If you don't know what that is, Google that. I don't know how to explain that. It's like a mortar and pestle.
Yeah, we're from San Antonio, so they're served like.
Yeah, your guacamole is usually served in it, but I don't recommend making your guacamole and then making your mojito funky taste. Okay, so we're gonna muddle. So I've got some leaves in here. We're muddling, swishing around. And again, we're not trying to crush them. We're just trying to bruise them so that they release their essential oil. Essential oil, all the rage right now too, by the way.
I didn't know that. I mean, I knew essential oil was the rage. I didn't know that. That was the point of muddling.
Yes, that is the point of
Oh,
muddling.
man. Learn something.
Oh, look, so you can already smell it. You smell it.
Mm-hmm.
Oh, I love mint.
Me too.
So good. All right. So now we've muddled. We're going to take some limes and we're going to squeeze that in there. And I like to squeeze the lime over. Yep, you can do yours. Over my hand, so that in case there's a rogue seed trying to ruin your drink, you catch it in your hand before it drops in your drink. And so we want 2 lime wedges. So this is a half of a lime, and then just cut and toss right under me. There you go. We're gonna put that right in there. And now we've got limey hands. Didn't think that through.
Well, we have these fun little napkins.
Yes, that say great minds drink alike, because, hello. Okay, so I'll take your lime.
Thank you. We'll use our. Oh, okay.
I'll give you that. Sorry.
Okay.
Oh, there. Okay. So the other thing it calls for. So a traditional mojito calls for sugar, like putting in 2 tablespoons of sugar. We're dentists. Okay, we're gonna move on to the simple syrup. Yes, it still has sugar in it, but here's the other thing. I don't like grainy in my drink. So I'm going to move with the simple syrup, and you want to use about 3/4 of an ounce of simple syrup. So I'm going to do that, and I'm just eyeballing this here, okay? And now, Carlin, if you'll pour 1.5 ounces of rum into each one.
Just an ounce.
No, I think it's 2.
Oh, okay.
No, it is 1 ounce. Right there.
Okay.
1 ounce.
I think because last week we thought we were doing 2 ounces and we only did 1.
Yeah, we kind of shortchanged ourselves. Hope you did not at home.
So yeah,
which is probably fine because we're the ones doing the talking, and if we're going to shortchange anybody, it should be us.
I mean, we'd be more fun if we did.
Yeah, maybe so. A little more chatty Cathy. So, you know, the great thing about a mojito is you can kind of play with the portions. If you like more lime, or you like more sweetness, or you like more mint, just add a little more. Or you like more rum. Sorry, there's that too. Okay, so we have that and that. And now we're going to add some ice that I strategically took out of the freezer this time so that it wouldn't be all stuck together like it was last time, and then I was struggling with it.
I didn't even notice.
Oh, well. And hello, I'm pawing your ice here. So that's okay. Okay. So now we got some ice in our glass, and I'm going to take some club soda here that I already have open because I did make a test run prior to this.
You did?
I did. I'm sorry about that.
I was running late, so I missed the test run.
You missed the test run. Okay, I'm gonna put this here, but now we're gonna grab another. And let's remember our motto, folks. Teeth are not tools, okay? Don't be opening any bottles of any sort or tearing any packages with your teeth. We don't want that, okay? So we got our handy dandy little opener here. Gonna top yours.
What is this?
This is
club soda.
Club Soda, and again, the Fever Tree blend, because quite honestly, I feel like Fever Tree is the Gucci of mixers.
Yeah.
I'm not a fan of the other ones. Now, if you have one that you love, you DM me and give me that recommendation. I will try it out. I'm just saying Fever Tree is the Gucci of it, okay?
Yeah.
So we're gonna put
Big fan.
Yes, we're gonna put some fun little straws in here that are paper, because save the turtles. And we're going to garnish this with a little lime wedge
That's beautiful.
that my daughter did not cut because she doesn't know how to cut limes. Look at what she did, y'all. Like, what am I gonna do with that? What am I doing with this? Absolutely nothing. Okay, well, she's only 14, so her drink game isn't strong yet. It's okay.
Our production team.
Production team, low paid.
Last week we forgot to turn our ring light on.
Yeah, so cheers,
Cheers.
to beautiful smiles. All right, let's try this. So little taste here. Oh, I just dropped the mint out. Or was that melon? Okay, let's see.
It's yummy.
Oh, it is yummy.
Mm-hmm.
Oh, that's good. Yeah.
And that was easy. That was easier than my mom's recipe.
Oh,
Yeah. She worked harder.
okay. Sorry, Carol. Come to my house. Okay. So our topic this week, we're going to talk a little bit about new patient exams. So for some people, you may be thinking, I haven't been to the dentist. I don't even know where to start. What's the next step? What do I do? Pick up the phone. Give us a call. And when you call, our team members should be asking some very pointed questions to you. And some people get frustrated by all the questions that we ask, but there's a purpose behind all of them. Obviously, we're going to ask, your general information about you. A big thing is if you're working with insurance, good grief, we've got to know all of that, including ID numbers, group numbers. And the reason being is that dental is not like medical. And it takes a lot of legwork for our girls to figure out what your benefits are and have that all in place before you arrive to the office. So if you come to the office and just hand us a ID card, whew, okay, a lot of stress, and we're not sure. What we're trying to do is to make sure that we're maximizing your benefits and to make sure that we're doing services that are covered for you, so that we're not surprising you with any out-of-pocket expense without notifying you first. Okay?
I think that's the biggest key. Like that's what people, and we're going to do a whole explaining insurance episode.
Yes.
We're going to have an insurance expert on down the road a little bit, but that's the biggest key. It's, our priority is to treatment plan the patient in the chair and to talk to you about your needs and your mouth, and in my case, your child's mouth, and put money aside. But we also understand that when you get to that desk and you would like to have some idea of what you owe and what this is going to cost you. So the more information you give us on the front end, the more accurate the information is going to be, and the less likely you're going to get surprised at the end.
Exactly.
I'm not going to edit my advice to you based on your insurance.
Right.
But we can give you choices, we can be knowledgeable, and we can explain it to you on the front end instead of on after you're surprised.
And upset. Yes. So that is a major question for us, asking all those detailed questions about your insurance so that we can gain all the knowledge that we possibly can. Now, keep in mind, dental insurances are not user-friendly for our staff, and so sometimes we get the information, we can have it in hand, no joke. It'll say at the bottom of the thing that says you're covered, and you're covered at this, and then at the very bottom it says still no guarantee of benefits. So we do our best to estimate what your out-of-pocket expense would be, but even the insurance company won't give us a guarantee on that. Okay, so enough on that. But some of the other questions that we ask that people are like, why are you even asking this? We ask quite a few medical questions on the front end, especially for adults. Are you on any medications? Are you on any blood thinners? Do you have any artificial joints? Have you had any recent major health issues, heart attacks, strokes? Why is that important? I'm just getting my teeth cleaned. Well, it's super important because our mouth is connected to the rest of our body, and it's actually the portal to the rest of our body. So when we do something in your mouth and we introduce bacteria into the bloodstream, that can create a host of issues if we're not aware of what's going on with you prior. So when you call, you'll be asked all those questions, and that's just, again, giving us as much information to be prepared for you so that we're using your time wisely when you get there. And I'll give you an example real quick.
Yeah.
If you've had a recent knee replacement, total joint replacement, you need to take antibiotics 1 hour prior to us doing something. And then people don't let us know that. They come in and we're like, we can't see you. We've got to talk to your orthopedic surgeon. We've got to get you on some antibiotics. And then you're frustrated because you came in, took time off from work, and we didn't get anything done. So that's why we're trying to be super detailed on the front end before you get there.
Another example is my grandmother. So my grandmother died of leukemia, and but prior to her diagnosis, I was a dental student at the time. I was not yet a dentist, but she told me that she had started having spontaneous bleeding in her gums, and she had gone to her dentist, and they had told her that she had gingivitis. Now, this is somebody that had no cavities, had never had a history of gingivitis, and it was spontaneous bleeding. It wasn't stimulated. So that's really important information to us, because that was her first symptom of leukemia, and it's not anybody's fault, because most of the time bleeding gums is gingivitis.
Absolutely.
But if we know something about your medical history going in, and we have some kind of history of what life has been like for you coming up to this moment, then sometimes a bruise on your gums isn't just a bruise on your gums, and so it is. Or you come in and we look at your gums and we're like, oh my gosh, she's got a lot of bruises on your gums, and then you're like, oh, by the way, I have leukemia. That's good information. And so we're trying to share. We look at it as oral health, not as a cleaning.
Exactly. This is all about your oral health, which study after study these days is coming out that your oral health affects your overall systemic health, and it plays a huge role in diabetes and heart disease and many other things. Okay, so we've gotten through the phone call, we've got you on the schedule, you come in, you're ready and excited to see us. We're super excited to see you. You get to the front desk and we're gonna give you some paperwork to fill out. It's just like going to any other office, y'all. We've got to get information on paper. We've got to get your signature, consent to treat you. Like, these are all legal jiggle things that we didn't come up with, okay? So we have you fill out the paperwork.
We're not really happy about doing them either.
No, exactly. Like, remember, like, when your grandparents would just go and, the bartender was the dentist, and, they had a drink and then the tooth got pulled. It's not that way anymore. Yeah. So we're signing paperwork. We got all that in, and then we bring you back. And at my office, that would be through that beautiful glass door that's still not installed. John, looking at you. And so
really?
we get you.
Still not there?
Still not there. No. But soon.
My stuff got done, by the way.
Oh, good for you. Okay, not me. John? Okay, so we bring you back, and we're gonna review your health history with you. So now you've filled it out, you've listed your medications, we're gonna go over all that. It's gonna get entered into the computer, so that if for some reason you need a prescription and I enter something, it'll pop up and tell me, whoa, danger, Mr. Robinson, you can't prescribe that. There's an interaction. There's reasons why we go over it. So we go over all that, and then we begin the process of getting to know you and your mouth. And that involves x-rays, which is a hot topic, okay? People, for some reason, feel like we should be able to treat them without x-rays. And despite getting my Pfizer vaccine, it did not give me the superpower of x-ray vision. And so I can see everything you can see in the mirror, but I cannot see in between, and I can't see underneath the enamel with my ordinary vision, even with my big old loops on that give me magnification. I need an x-ray.
I have a Wonder Woman cape and Wonder Woman shoes at my office, and I still need x-rays.
Yeah. So let's dispel a little myth about x-rays, okay? It's not killing your brain cells. It's not going to give you more radiation that's going to cause cancer. We both use digital x-rays, meaning they're not the old little cardboard pieces that you used to have to bite down on, and then someone had to go dip them into developer and fixer and hang them up to dry.
That's probably where most of the cancer came from. It's our staff developing.
Yeah, exactly. They're the ones that got cancer, not us. So we take digital x-rays, boop, shows up right away on the computer screen. You're getting, if we take a full mouth series of x-rays, which usually is comprised of 16 to 18 individual x-rays of your teeth.
Not in pedo.
Overlapping, different shots, different angles so that I can see different things. You're getting less radiation from our digital x-rays than if you step outside in the sun for less than 5 minutes, okay? So let's get over that x-ray barrier. So we're gonna get our full set of x-rays. For you, that involves?
Really, for me, it depends on the age.
Okay.
So if you're under 3-ish years old, we only take x-rays if there's an emergency,
Sorry.
which one of our episodes is going to be trauma and stuff like that. So under 3, it's got to be an emergency, or there's got to be something that's just not right.
Okay.
And we're just trying to figure it out. Then 3 years old, if we still have space between all the teeth, we'll often just take that front series, because a lot of babies and a lot of children, a lot of people have extra upper front teeth. And so we start looking for that kind of a situation. We also, it's a little practice also. Then once you hit about 4-ish, we start, if cooperation allows.
That's key. That's key.
We start taking them on the back. So we'll take 2 on each side, an upper and a lower, if we don't already have the upper and a lower. Around 7, 8 years old, or early mixed dentition, meaning you've got some permanent teeth and some baby teeth. That's when we'll take that panoramic one that goes around your whole head. And in my office, I have the panoramic x-ray that blocks the thyroid and the orbit, since my patients are in such a junior developmental stage.
Right.
So that's just an extra layer of safety. And I was told that even without a lead apron, or now they have lighter weight ones that aren't really lead, but they function like lead. So those are really nice. But even without an apron, a panoramic x-ray on full setting is like going through TSA at the airport.
Summer travel.
Yeah.
Okay, well, and to kind of piggyback off that, we do use lead aprons with a thyroid collar. I have a thyroid issue, so I certainly don't want to cause any for anybody. So that is always protected. So now we've got our full set of x-rays. Now I'm beginning to take a look at everything. I'm looking at what's already there. I'm calling all that out to my assistant. She's charting all of that. I'm then comparing with x-rays to see if there's any cavities or any areas of infection. So here's an interesting thing. You could have what appears to be a really small cavity just by looking, like we see a little dark spot, but then on the x-ray we see that it's actually kind of blown up underneath there, and that we have infection at the tip of the root. So all things that we can't see without that x-ray. So I'm going through all of that. I then do an oral cancer screening. So oral cancer, becoming one of the more prevalent cancers these days. We're looking at the tongue, we're looking at the floor of the mouth, roof of the mouth, we're looking at all your gums, we're looking at the back of your throat. I then go through and I palpate all your lymph nodes underneath your chin, on your neck, up underneath your tongue here, back of your head. And then we check your joints, because a lot of people are under a tremendous amount of stress right now with this little thing called COVID. And they have been like grinding and clenching their teeth and causing some major joint issues. So we're checking the joints. How are they functioning? Do I see any movement when you open? Some people don't open straight up and down. They open and shift to the right, and that puts a lot of stress on your joint. So these are all things that we go over in our new patient exam. And then, once we collect all this data, one of the final things we do is we also go around and we check the health of your gum tissue. And so this is super important for anybody that's over the age of 18, is that you should be having a yearly periodontal exam. And that involves, here's how I tell people, because it doesn't quite make sense if you're just listening to numbers and stuff. But if you look at your teeth in a mirror, where your gums meet the tooth, they kind of roll over, right? If we pull our lip down and look, we can kind of see that little rolled edge. Well, that's a very measurable area for us. And healthy gums measure between 1 and 3 millimeters. 4 begins to tell us there's inflammation. 5 begins to tell us there's bone loss. And then the higher the number, the greater the bone loss. So we go around and we measure 6 spots around each tooth. It's pretty tedious for us.
We don't have to do
Yeah, kids, no, but over 18, lucky, winner. So we measure 6 spots around each tooth and we're calling out those numbers. So if you've ever been at the dentist and your hygienist is like 332, 223, 323, that's what we're doing. We're measuring the health of your gum tissue. And so important because the majority of adults these days lose teeth, not because of cavities, but because of untreated gum disease. And this is what tells us what type of cleaning you need, how frequent we need to see you, if we need to have you on any special mouthwashes or rinses. This is what gives us all that knowledge about how best to treat you. So
yeah, and that's really good information. And when I said we don't have to do that, of course I'm still doing a gingival exam. I'm looking at gum health. I'm looking for lumps and bumps and things that, one of the tips I would give you is look in the mirror, like pull your lip up. I'm on camera and I'm not going to want to see that later, so I'm not going to do it for you. But pull your lip up and kind of look for symmetry. Look at the left side, about the same spot over here as you're looking over here, and see if you look kind of symmetrical. Because when our eyes catch something, it's usually because this side doesn't look like this side. That's a big clue for us that something's going on. Symmetry is a really big deal in face stuff, which my face is not symmetrical.
Nobody's is.
Yeah, I mean, nobody's is perfectly symmetrical, but me, I have like a Teflon cheek implant because I didn't have a cheekbone over here, and all kinds of fun
screws
stuff.
and plates from my jaw surgery.
Yeah,
too. We're like bionic women over here. We'll talk about that some other time.
It contributes. But yeah, so we're looking, and then as you develop pocket depths, what she's talking about, aren't really good predictors in my patient population because you're growing and changing so much. The only time so I use x-rays and start looking, every now and then with a really rare genetic or disease, we'll start to see crazy bone loss in kids, and that's a huge alarm. Because we just don't usually see that. We don't even see a little bit. And then what? We have you as little kids in a transitional dentition, and then you get braces. Well, braces messes up your pocket depths too. So we look for problems. We do a screening probe. It's called a PSR. So where she's measuring, and probably at your 6th month, y'all probably do PSRs, and at the year they do the full 3, 2, 3, 3, blah, blah. We just do a PSR. Once you have full adult dentition and you're not in braces. It's more of a screening tool because guess what? I don't deal with periodontal issues. So if you're in my office and you're 15 years old and you've got a 5mm pocket, you're going to hurt. And so that's kind of how that works. But so I look for lumps and bumps and growths. My job is more growth and development. So my exam is, not that many kids are going to have a big problem. Usually her patients have their life of habits that are catching up to them, smoking and things like that. I don't have that. Mine is more usually genetic based, right? Do we have a growth and development issue? Do we have dad's teeth and mom's jaw? Do we, how are we managing? And so in my office, grinding, where you're talking about stress, kids usually don't grind from stress. Kids usually grind from an airway problem. So that gets back into our systemic stuff. Kids grind because they're growing. If your 1-year-old is teething and they're grinding their teeth to death, that's because they're teething. We bite in the same place every single time. A kid doesn't. And so if you have a kid that's really an investigative kid already, they are likely to grind to check that out. Now, other things are if we have a lot of allergies, we're going to grind more. If we have reflux, we're going to grind more. And guess what? Reflux is really hard to diagnose in children. So those are the things that I'm talking to you about and I'm looking at is do we have an airway problem? Do we have a tethered oral tissue? Do we have big tonsils that are going to lead to sleep apnea, which causes ADHD and problems learning in school? So that's the kind of stuff that I'm looking at. So when people are like, why do I bring my kids at 6 months old
Right.
to the dentist? We say first tooth or first birthday, and some insurances recommend 6 months as well. So the reason for that is so we catch some of these things early and we can start educating. So the early appointments are really about educating the parent.
Right.
And teaching good habits and talking about diet and drinks. Drinks are so big. And avoiding gummy things, even gummy vitamins.
Oh, gummy vitamins.
So that's why we have you come so crazy early to get started. Sure, is your 1-year-old likely to have a problem? Well, I mean, if they're nursing all night or drinking juice between every meal or something like that, then I mean, we are definitely looking for cavities, but we're also mostly looking for prevention and for guidance and for systemic problems.
Right. So new patient exams, you know, it's the first place to start. It's the first place to gain information for us, but also for you to get an idea of where you're at, what needs to be done. At the end of gathering all that information, I always have the patient sitting up. I always tell people, let me sit you up so you're not thinking on your head, because I know that laying back makes people feel very vulnerable, and it's an anxiety-inducing position. So I sit you up. I have the x-rays here on the computer screen so that you can see. We also take a full set of intraoral photos, so just like a camera. So, you know, like a picture of your face, we take a picture of your smile.
It's like on a wand like this.
Yeah, it's like a little wand. It goes in, it snaps all these photos so that you can actually see the dark hole that I'm seeing, or you can see the little spot on your tongue that I'm concerned about that I'm seeing. And so then we go through and we do a tour of your mouth basically, and here's what I'm seeing. We start, you know, right to left, and then I always want to know what your biggest concern is. What brought you in? What do you want to accomplish first? And then we're going to talk about where that ranks, where I think in your priority list as far as your treatment needs. Yes, you want to bleach your teeth, but you know, maybe we have some cavities that if you do that now, it's going to make things super sensitive. So let's try and accomplish so that you get your end results, you know, that you came in looking for, but we also know that we're doing it in the best way possible for you with the best outcomes so that your oral health is taken care of. So
I do want to address one more expectation for pediatrics, because you've been in my office, you've heard the rodeo.
yes,
Guess what? If your kid is under 3, you've got a 75% chance they are going to scream.
oh for sure,
Yeah.
oh
Yeah.
sure,
Like when we have a 2-year-old that doesn't scream, we're like, oh, wow.
yeah.
So
Yeah, that parent gets a prize.
yes. Well,
It's not the parents.
It's not.
parenting. Because my 3-year-old, when she busted her teeth on a glass coffee table in front of 7 dentists, screamed like a banshee the next day when we tried to get an x-ray on her. So it's not about parenting, because again, going back to, remember my kid had cavities too? Even dentist kids can be, you know, a little unruly. And it's not that they're unruly or bad kids. They're just scared. They don't know what to expect, and you can't reason with them at that age.
honestly, that's kind of why I became a pediatric dentist. I'm not like, you know, I'm pretty good at talking to kids, but I'm not like some super, I don't have a magic wand, and although I think I want this. Anyway, I don't have a magic wand, but a kid being upset is so honest and so true to them. And, you know, when I used to treat adults, because I was a general dentist for 9 years, I would have patients that would pretend something wasn't hurting because they thought they couldn't say. They would pretend and maybe not disclose everything. And I found that a challenge for me. And so I don't mind that the 2-year-old is screaming. And you might actually think I'm being brutal, but what I know in my head is I'm not causing pain. I'm just looking. And a toddler, once they hit about 11 months, that's when it all hits the fan.
Oh, yeah.
A toddler is learning independence. They are learning to explore their world on their terms. And I am laying them back, and to them I'm a stranger. Even if they're coming every 6 months or every 3 months, they're not seeing me frequently enough to think to be one of their people, right? And so we're putting them in a vulnerable position with a stranger in their face, and
Wrapped up and masked.
yeah, it's fine. And I just tell parents that it's fine. I just pretend I don't hear it. I sing my little song, brush, brush, brush your teeth, brush them left and right. There's more. And I just pretend I don't hear it. And I'm not trying to be cruel to your kid, and I'm not ignoring the fact that your child's upset. It's just normal. And that's what they do. So please set that expectation for yourself when you take your child to the pediatric dentist for the first few times even.
Right.
It gets better.
It does. It absolutely does. And what I tell people that when I do see a child, I don't know how y'all do this, but I tend to do like a knee-to-knee exam where mom is maybe holding child this way, like facing them, and then they lower them down, so like
Into my lap.
into her lap, so that she's looking over, but mom has a hold of baby. And then it gives a great view. So what I tell parents is do this at home when you're brushing your kids' teeth. Sit on the floor with them, lay them back into your lap. It gives you a great view to brush their teeth and make it a game. And then when they come to the dentist, it's not so foreign to them. So
Yeah, for
there.
sure.
Look at me with my pediatric tips.
Yeah, she can do it.
I can't do it, but I send it to her. So
She
there you go.
doesn't really love the screaming.
No, I don't love screaming, but I get it. So don't be upset about it, because again, I've been there. I was never so mortified as when my 3-year-old lost her mind at the pediatric dentist in Albuquerque, New Mexico. You know who I'm talking about. And so anyway, I'm just saying, don't
Our
be upset about
production team is offended by these remarks.
Oh, well, she's fine. She's 14. She'll be okay. So, okay, listen, this paper straw, bless the turtles. I'm just saying, but it's losing its steam, and I'm sucking up mint leaves. So here's another little, I'm going to revert just a tad, sorry. You can strain your drink, make it in a cocktail shaker and strain it so you don't have the mint leaves, so you don't suck them up in your paper straw.
Carol did do that.
Carol did that. Of course she did. Of course she did. Okay, so that kind of wraps up our new patient exam, right? We're going to call, we're going to give a lot of information, we're going to have that insurance information ready. We're going to come in prepared to fill out paperwork. We're going to have x-rays taken, because super important, no x-ray vision here. And then just be open and honest. That's what I tell my patients all the time. It doesn't matter, no need to apologize. I'm sorry I haven't been to the dentist in 10 years or whatever. It's okay, you're here now, and that's what's most important. And we'll get through it together as long as there's open and honest communication.
Couldn't set it better myself.
All right, well, these are my grandmother's glasses. I gotta throw that in there. I think it's kind of cool.
I like
Like
them.
I was trying to figure out what am I gonna put my drink in, and I looked up in my little cabinet there, and my grandmother's glasses. I don't know what she used them for, but she was a pretty cool lady,
Yeah.
Momo. So shout out to her. She probably had quite a few cocktails in these.
Probably.
So,
Well, mine's empty, so we need to be done.
all right. Well,
Cheers to beautiful smiles.
cheers to beautiful smiles, y'all.